Good morning, dear student. In today's lecture, I will discuss the use of chelating agents. So, different chelating agents are used, or which binds with metal ion and it having a different activities. So, in this lecture, we will discuss some chelating agents. When they binds with metal ion, then it's specific in use. So let us discuss the first one, that is antimicrobial activity of chelating agent. Antimicrobial activity of chelating agent. So which chelating agents having antimicrobial activity? For example, if you consider the example of this antimicrobial activity of chelating agents, there are different examples of chelating agent. First one is tetracycline. Tetracycline. So if you see the structure of tetracycline, it is OH is there, having CH3 OH is there, double bond O is there, double bond OH is there, it having NH positive, having CH3 twice, O minus is there, CONH2 is there, and this is your double bond. So this is your tetracycline. When this oxygen it binds with hard cations such as calcium and magnesium, then it will shows antimicrobial activity. So you should remember this tetracycline. This is the first chelating agent. Second, if you consider the second example, that is oxime. So we are very much familiar with this oxime. It is 8-hydroxyquinoline. It is 8-hydroxyquinoline is there. It also having a antimicrobial activity. 8-hydroxyquinoline. So we are very much familiar with this. OH is there, nitrogen is there. 8-hydroxyquinoline. Another examples of this antimicrobial activity as a chelating agents, that is thiazine. THAZINE. Thiazine. So if you see the structure of this thiazine, it is CH3 C double bond O N H, which is attached. Then it is CH double bond N, it having NH, it having C double bond S NH2. So you should remember which chelating agent and its role, which chelating agent and its activity. So these are the chelating agents having antimicrobial activity, that is tetracycline, oxime, thiazine. Again, the one more that is very important, that is isonicotinic acid. Isonicotinic acid. Isonicotinic acid, or it is also known as isoniazide. Isoniazide. If you see the structure of this, it is C double bond O NH NH2. Isonicotinic acid. Again, if you consider different complexes of arsenic, antimony, and mercury, they are toxic, but some of the compound at low concentration shows antimicrobial activity. So the complexes of arsenic. So this is your arsenic complex. That is double bond O, OH is there, OH is there. So arsenic complex, phenyl arsenic acid. It is known as phenyl arsenic acid. Again, another example is uh, of this metal ion, that is arsenic. So we are very much familiar with this complex, that is arsenic. Double bond As is there, then it having NH3 positive Cl minus, and this is your OH is there. Again here also NH3 positive Cl minus having OH is there, and its name is sulfuracin. Sulfuracin. It is also used as a, or it is also have an antimicrobial activity. So these are the some chelating agent. So you should know its structure and its activity. So these are the ligands. It is not ligands, it is a chelating agent, or we can consider it as a ligand. It having antimicrobial activity. Let us discuss the different. Let us discuss the different chelating agents. So, if you consider the second most uh, chelating agent, that is your aspirin, acetyl salicylic acid, aspirin, O C double bond CH3. So, this is your chelating agent. Aspirin is also chelating agent. It is acetyl salicylic acid. It is used as an antipyretic. It is used as antipyretic. It is used as a antipyretic. Again, one of the important role of this aspirin, that it reduce the flood of copper. It reduce the flood of copper in blood. It reduce the flood of copper in blood and reactivate the cell by meeting their copper deficiency. So this is also a chelating agent which is used as antipyretic, and also it having a role reduce the flood of copper in blood. Again, uh, the next chelating agents which is used in cryotherapy. So we are very much familiar with these terms. Cryotherapy. So chelating agent which is used in cryotherapy, it is known as anti-arthritics. Anti-arthritics. Okay, the chelating agent which is used in cryotherapy. So what is this cryotherapy? The use of gold component in the treatment of rheumatoid arthritis, it is known as cryotherapy. So whenever a gold compound is used, then it is considered as a cryotherapy. So they are used as a anti-arthritics agents. So we are very much familiar with these chelating agents used in cryotherapy, that is the gold complexes. The first one is AU, SCH, CO2 minus Na positive. Again, this is your CS2, CO2 minus Na positive. So this is your myocrysine. So we already discussed this myocrysine. It is also act as a chelating agent in which the gold is attached. So it is myocrysine. Again, the next one is the solganol. Next one is solganol, copper containing, or not copper, it is the gold containing chelating agents. Solganol. This is your SAU, hydrogen is there. This is your HOH, OH is there. Again, HOH is there, and this is your HCS2OH is there. So this is your solganol. So when the gold, when it is not attached to this ligand, then it is considered a chelating agent. So you should remember. So the solganol, it is also used as a also used in the treatment of rheumatoid arthritis, that is in it is cryotherapy. Again, one more, that is ornofin is there. So we are also familiar with this ornofin. So if you consider here, so again, this is your ornofin is there. Ornofin is there. So sulfur, then it is attached to AU, and then it is attached to PET3, and the remaining is same HOAC is there. Again here HOAC is there. OAC is there. Again here also HOAC is there. And this is your HCH2OH. So we are very much familiar with this. This is your ornofin or aranofin. So these are also a chelating agent. When the AU gold is attached to this chelating agent, then it having an activity that is anti-arthritics. It act as a anti-arthritics. So this is all about the chelating agent which is used in cryotherapy. Again, if you consider uh, the agents, we are very much familiar with this also. The insulin mimetic agent, insulin mimetic agents insulin mimetic agents. For example, if you consider the example of this insulin mimetic agent, that is BMOV, capital BMOV, in which the ligand is maltol. The ligand is maltol, that is 3 hydroxy 2 methyl 4 pyron. So we see the structure of this, that is your CH3 is there, oxygen is there, O double bond is there, okay, oxygen, double bond oxygen is there, and this is attached to this vanadium, double bond O, again O is there. This is your maltol. The ligand is maltol. When it is attached to this vanadium, then it is having activity, that is it is act as an insulin mimetic agent. It is act as an insulin mimetic agent. So this ligand is maltol 3 hydroxy 2 methyl 4 propine. It having an activity, that is it is act as an insulin mimetic agent. So instead of insulin, we can use this agents. So this is regarding to the insulin mimetic agent. So you should remember this chelating agent. Again, the one more is uh, the anti-malarial metal complexes of chloroquine. So chloroquine, it is also having an activity, that is anti-malarial activity, anti-malarial activity, anti-malarial activity. So you should just remain the structure, that is chlorine is there, then there is a nitrogen is there, and if you consider, it is NH having CH3 is there, N C2H5 twice having positive charge, PF6 minus. Again, this nitrogen, it is attached to AU, and this is your PPH3. So this is the chloroquine complex having anti-malarial activity. So this is all about the role of chelating agent in pharmaceutical chemistry. So you should remember every chelating agent, its structure and its activity. So at least you should know which chelating agent is used as a which chelating agent having antimicrobial activity, anti-malarial activity, insulin mimetic activity. Then another is anti-arthritics, which is antipyretics. So again, there is a lot of chelating agents used in medicinal chemistry. At least you should know the structure and its activity. So in next lecture we will discuss the points which is remain from this section. Thank you.